Hi, everybody. It's Todd and Leslie, and we are here with a mini PEP update for you. The holidays are coming up, and we do not want you to be stopped by the clot during holiday travel. So we're going to give you some information on how to stay safe and healthy, and we're going to kick off with some tips on keeping that blood flowing. So holidays mean you may be traveling and possibly going some long distances. So if you're going by plane, by train, by automobile, and you'll be seated for several hours, try doing some leg and ankle exercises. We have a few here to consider doing, and our lovely model, Todd, is going to take it away and share some information on some of these leg and ankle exercises. Todd?
Yeah, and I hope everybody has happy holidays. We're just getting started. We're going to have a busy traveling season. So, I mean, so many people are now going out since restrictions have been, cut way down. So a lot of people traveling, a lot to think about if you are a blood clot survivor, or even if you haven't had a blood clot and you're just thinking how to prevent a blood clot and deep vein thrombosis. I think we have some good tips for you. So I'm just going to ramble through a quick list that I follow myself when I do traveling. And an important thing to remember is the longer the trip, the more vigilant you need to be when it comes to prevention. The longer your legs are pinched at the knee, that when we sit on an airplane, sit in a car, our legs are pinched. That's what constricts the blood flow. So the longer we sit, the more risk we have, and the more we need to manage that risk. So if traveling by plane, be sure to get up every 90 minutes to a couple of hours, walk the cabin. I like to recommend taking a pre-travel walk. I notice when I go to the airport, I'm sitting in the boarding area, then I'm called to the plane and I'm sitting again. I'm not really mixing that up much. So I try to take a pre-walk and do that even if you're traveling by car. When traveling by car, there is a difference between being behind the wheel and being a passenger, right? So you need to be careful when you're trying to stimulate blood flow and you're behind the wheel because you've got your pedals right there and you're really trying to focus just on driving safely. You have a little bit more wiggle room if you are the passenger. But if you're solo driving, if you're just driving, period, you need to make sure that you stop frequently and take what I call stop and stretch breaks. So try to do that every 90 minutes to a couple of hours. If you're the passenger, you have a little bit more wiggle room. Like I was saying, extend your legs out straight out in front of you when possible, and flex your ankles to you by pulling your toes towards yourself. Ankle clocks and ankle circles are a super easy blood flow exercise to do. And that's just where you elevate your foot and you turn your ankle in circles back and forth, forwards, backwards, clockwise, counterclockwise. I try to do that at least once an hour. Knee lifts, you can pull each knee towards your chest and hold it there with your hands on your lower legs for about 15 seconds. If you repeat that 9 or 10 times, that gets the blood flowing. I like to do air alphabets. So when I was a kid, actually still as an adult, I like to air guitar. When I'm rocking out to my music, well, now I air alphabet when I travel. So I elevate my leg and I use my toe as a pencil and I will write in the air the alphabet from A to Z and then back. And trust me, that is quite a workout. And you'll feel it. And it's also a good way to kind of break up the boredom because it takes a while. But that's something you can throw into your prevention repertoire. And a couple of safety tips. Try not, and I think we're all guilty of this. I've been guilty of this in the past. This is just a safety tip for me. Try to resist the urge of putting your feet and your legs up on the dash or out the window when you're a passenger in the car. And I only say this because it's going to be a very busy time on the roads. Driving is a risky thing to do anyway, because it's just, that's just where a lot of accidents happen. You don't want your feet and legs up on the dash and get into even a minor fender bender. If that happens, you're going to risk some serious injury and you're going to have even bigger problems than a blood clot. So try to resist that urge. Just make sure you stop, make sure you do these blood flow exercises and you'll be fine. And then the other tip I have is to wear loose fitting clothing. Don't wear the painted on jeans while you're traveling in the super tight muscle shirt. That has the ability to constrict blood flow. So try to wear some loose fitting stuff. And as far as compression goes, compression stockings have been shown to help increase blood flow. But our advice to you is make sure that you get prescribed compression stockings. And the best way to do that is by visiting with your doctor, or better yet, a vascular specialist who can prescribe the right kind of compression. Leslie and I recently had a mini PEP on this, and the point was brought up that you need compression in certain parts of your legs, based on your individual needs. So that's why that prescribed compression is really best. But yeah, I think those are some really good tips. And Leslie, I know you have some as well.
Yeah, and I have to credit you with the AIR alphabet. So after I had my blood clot, my first coast to coast, West Coast to East Coast trip that I took, I was really nervous. And so I did these exercises and I threw in your ankle clocks, and yes, indeed, they work great, and they did hurt a little bit, but I knew my blood was flowing, and that was important. So another consideration is just to make sure that you hydrate. Dehydration, as we all know, increases the risk of blood clots. So we want to make sure you stay hydrated, drink things like water, low to no sugar fruit drinks, even low to no sugar energy drinks, even things like Gatorade, as long as it doesn't have a lot of sugar in it. Stay away from alcohol and caffeine, as these actually dehydrate you. And so I know everybody imbibes over the holidays, but if you're traveling, really try to avoid it, or drink a fair amount of water as well. And that goes with you when you are having your dinner, not just traveling, but make sure to hydrate. And then, we know that it's hard to have your regular workout schedule when you're traveling as well, but let's all try to find, a few minutes to walk, going up the aisle of the airplane, down the hotel hallway, or just like a brisk walk down the street. I would try to, when I would travel after my blood clot, I would always try to walk up and down my hotel hallway to get my steps in. Calf races are also great to keep that blood flowing. I do that on an airplane. I do that when I'm standing at my desk. I do that when I'm standing at my dinner table sometimes. So a great exercise. 5 minutes is better than no minutes. And when I'm on an airplane, I often tell the flight attendant before we take off that I'm actually a blood clot survivor, that I had a pulmonary embolism, and that I do need to get up and walk. And if they see me doing it, that's why. I have never had anybody say, no, you can't do that. I mean, obviously, if there's a lot of turbulence, then we go to Todd's exercises. But they've been super supportive about being able to get up and walk on the airplane. So don't be shy about saying to them, hey, I'm a blood clot survivor, or I'm trying to prevent a blood clot, and that's why I'm walking. Todd, back to you.
Yeah, and the great thing about that, Leslie, is you start talking to somebody about that, you're raising a little awareness at the same time, right? And I'm glad you focused on the hydration part. I think that if we make sure that we're, and so many Americans, and probably around the world as well, we're chronically dehydrated. The majority of the population is. And the thing is, if you make hydration a part of your prevention plan and do it on a regular basis, you're going to have to get up to relieve yourself anyway, right? So you're going to have to get up and walk down the cabin. You're going to have to stop the car. So yeah, great point on staying hydrated. Another thing about traveling, if you're on anticoagulants, I've always highly recommended wearing a medical alert ID bracelet. You can get these from anywhere. They come in different shapes and sizes, different types of jewelry. Bracelets. I wear a military dog tag. On my watch, I actually have a medical ID tag for my Garmin. So I have this on 24/7. But if you wear an ID, that's just a good idea for you in case something happens and you're unconscious. You want the medics to be able to respond to that information that's on your tag. And it's also for your family, right? So win-win, have a medical alert ID if you can. Now, suppose you get to your destination and your leg is throbbing, you are experiencing DVT symptoms, right? Swelling, pain, warm to the touch, red, whatever, and you're worried about it because it's abnormal. Because you've traveled, it's a good idea to head to the ER. Go get checked out. Better safe than sorry. Yeah, you're gonna, spend a little time doing that, but just imagine what happens if something is wrong. You'll get treatment. If not, your anxiety's reduced, so you can go on enjoying your holiday time with your family. So always go to the ER anytime you have any of those problems. And that goes for anything like, rapid heart rate, you've got a hard time breathing, you're having chest pains, you're coughing up blood, God forbid. I mean, if you're having some serious lung issues and breathing issues and pain issues up in your chest, make sure, again, you go to the ER because you want to get checked out for pulmonary embolism. Traveling is a high-risk situation for thrombosis. That's just a well-known fact. So you you really need to be on your mark and make sure you go to the ER if you're having problems, Leslie.
Yeah, absolutely. Very good point. Okay. And something else to consider. Remember, if you are on an anticoagulant, make sure to keep taking it, please. One of the biggest risks of blood clot recurrence is not taking your medication. So make sure you pack it on your carry-on. We love the airlines. Don't put it in your suitcase because there's a chance something happens to your suitcase and then you won't have your anticoagulant with you. So please put it in your carry-on. I do that with myself. I have like a little red bag that I put into my pocketbook so I know where it is at all times. And that's kind of the first thing that goes into my bag. We want you to be safe and have a great holiday. These tips that Todd and I have shared with you, they can help prevent a blood clot. So try to practice them, share them with your friends, your family, even the guy seated next to you on the airplane who might not want to talk to you. Sharing can save a life. Right. And we really want to get this information out to as many people as possible. And we want you to be safe.
Yep. And as always, you can go to www.stoptheclot.org, and we have a ton of information. We have so many new resources that people are loving. We want you to share those resources, help raise awareness, help educate. This is all about keeping ourselves safe and everybody that we care about safe as well. So happy holidays, everybody. Just travel safe.
Yeah. And Todd, I have a little idea while you were talking. It would be great to have some of the patient community, when they're traveling, send some video or pictures in of them traveling, doing their exercises that we can share with other people. And echoing Todd, have a wonderful holiday. Stay safe. Stop the clot, and we'll see you soon.
Happy holidays, everybody.
Happy holidays.